Hey Pam.
Hey Sarah, I wouldn't sit there if I were you. I haven't been feeling too great recently.
Oh my god, yeah, I've heard the flu is going around like crazy in the school right now.
Yeah, I've been feeling really dizzy and really tired, but I only have to chill, so my mom's making me come to school. She's so annoying. She only lets me stay home if I have a fever or if I'm throwing up.
Well, luckily you don't have those for now because the big senior dodgeball game is tomorrow.
Yeah, I'm so excited. Hopefully I feel better soon. I think my mom's just gonna take me to my doctor tonight just to be sure if nothing's wrong.
Checkpoint questions, scene number 1. What symptoms does Pam show in this scene? What are some stress factors in Pam's life right now? What could Pam's diagnosis possibly be right now? How does Pam's frustration with her mom contribute to her condition? Why would it be good for Pam to go to the doctors instead of assuming her condition?
Hi Pam, what brings you in today?
Dr. Rice, I've been feeling really dizzy lately and just a bit out of it. I feel extra tired and the flu's been going around my school like crazy. And I just want to make sure that's what I have so I can get better.
Well, have you experienced any other symptoms?
Just being annoyed at my mom all the time. I feel like she's stressing me out over unnecessary stuff and doesn't believe I'm sick when literally everyone at school is. On a serious note though, it's pretty much just those, except I get the chills from time to time.
Well, we will test you for the flu and check the results. We got the test back and they came back negative.
Oh,
Have you been experiencing any kind of stress lately?
just some school stuff. I mean, there's a lot of events coming up, like the big senior dodgeball game, prom, and picking where to go to college.
We have resources here if you ever need someone to talk to, but my advice for you is to try to take it easy, enjoy your senior year. Also, try to wind down a little bit earlier to help with the tiredness. Do you want me to set you up with our in-house therapist?
Thank you for the advice, but I think I should be fine. But I'll let you know.
Checkpoint questions, scene number 2. What symptoms does Pam mention to Dr. Ice? Why do you think Dr. Ice asked about stress? Is it possible for Pam's flu test to be a false negative? If Pam doesn't have the flu, what do you think she could have? How could the therapist help Pam's condition?
Hey Pam, how are you feeling today?
Not all that great. I still don't feel my best. But I'm here. And the good thing is that my test for the flu came back negative, so.
Good. Whoa. Watch out! Oh my god. Pam.
Hi Pam, I'm Dr. Spice. I have some paperwork for you.
Hi, I'm so confused. I only got hit with a dodgeball.
Well, this might be a lot of information to take in, but we've figured out what has been going on with you. I'm going to type everything up for you to look back over later.
Okay.
To start, you had a heart attack, but you recovered great. It looks like you were born with a congenital heart defect. Many of these can go undiagnosed in people until a major event. This has led to you having coronary artery disease.
Wait, I'm confused. Have I always had this?
Yes, since you were born with congenital artery issues that have gone undiagnosed, you're at a higher risk for spontaneous coronary artery dissection rather than traditional plaque buildup. SCAD is a tear in the artery wall that leads to a heart attack. This is the leading cause of heart attacks in women under 50, often affecting those with no prior risks, and this is the most severe symptom of coronary artery disease.
So this is why I've been feeling so weird lately.
Yes, with the stress you've been experiencing and the large hit you took to your chest is what caused the tear, and your undiagnosed condition adds to these as well. Your original symptoms seem harmless and can lead to many other diseases or illnesses, so coronary artery disease can be misdiagnosed or missed in emergency settings. The heart attack is what led us here. Your primary care doctor had no way of knowing that your symptoms would lead to this.
Okay, that makes sense. What could have happened if we didn't find this?
Well, as you can see, the effects of this condition are sudden, and as you experience, life-threatening. For most people, it is fatal because it's not early enough, or they don't seek medical attention and proper treatment after experiencing a heart attack. Luckily for you, you made it here where we will make a plan for your recovery. People like you who catch it early are able to fully recover, but now we will have some lifestyle changes.
Wow, okay. What will I have to do?
We are going to have to make adjustments with your lifestyle, add medications, and in this case, we will do a minor repair. In serious tears, especially in coronary, a small balloon tip catheter is used to widen the artery, and a metal stent will be placed to keep it open.
Will I ever go back to living my everyday life?
Of course you will. We are going to prescribe you aspirin as an antiplatelet agent, 81 milligrams daily, for long-term use to prevent blood clots. dual antiplatelet therapy, which is a combination of aspirin and another agent like Clodrogel that you are going to use for the first 3 to 12 months. A beta blocker called Metropropyl that will reduce blood pressure and decrease the workload on the heart. And lastly, statins, even though you don't have high cholesterol, because they're going to help with the vessel healing.
Wow, this is a lot to take in, but I'm glad we figured it out what's wrong so I can start to feel better.
That's a great attitude, Pam. You'll be on the mend before you know it.
Checkpoint question scene number 3. What event triggered Pam's heart attack? Why did Pam's congenital heart issue go undiagnosed for so long? What is spontaneous coronary artery dissection, or SCAD? What treatment might Pam need to repair the artery tear? Which medication combination will Pam use for the first 3 to 12 months?
Pam, it's so good to have you back at school.
Yeah, they kept me in the hospital for a little while to monitor my condition and to make sure I recovered from surgery properly.
That seems scary, but I'm glad you're feeling better. You have to tell me everything that happened.
Well, I was affected by coronary artery disease, but they gave me medicine to help and they did a surgery. I just have to remember to take all my medication now before I go to school.
Wow, are you going to be able to still hang out and go back to your life?
Yeah, I should be able to. They told me I just need to live a little more cautious lifestyle now. I can't really do any intense workouts or raise my heart rate too much. I'll probably have to take that medicine to my entire life and get regular checkups. Also, they recommended me a therapist for me to help manage all the added stress going on in my life right now. It sounds scary, but I've got this.
I still can't believe this would happen to you. Like, what are the odds?
Yeah, I mean, they aren't really high. Only 1 in 100,000 people get diagnosed with this every year. This was a rare occurrence. Coronary artery disease usually only affects women over the age of 50 and men over the age of 45. The older you get, the higher risk you're at. In the US, older white and South Asian men have the highest prevalence. That's why they would have never assumed I would have had this disease, even though I showed symptoms of fatigue, dizziness, and even the chills. They just assumed that it was something small.
This is a lot to take in, and I'll be here to support you every step of the way. I'm
Aw.
glad you're feeling better.
Me too. Checkpoint questions scene number 4. Why was Pam kept in the hospital after her heart attack? What lifestyle changes does Pam need to follow now? Why was Pam's diagnosis surprising to her doctors? What symptoms did Pam experience before her heart attack that were overlooked? What additional support was recommended to help Pam manage her condition?